So would you say by at least a month they should be able to wear regular tennis shoes?
Yeah, so normally as swelling permits, I'll start to transition the patient out of the boot into shoes. Earliest I've done it to week 4. Most of the time patients we're looking at week 6 to week 10, somewhere in that ballpark, depending on their medical comorbidities, rate of healing, size of the patient, all that kind of dictates it. It's really swelling and pain as their guide is what I always say. And so if swelling and pain allows it, go into a shoe. Swelling and pain don't allow it, don't go into a shoe yet. Typically in my patient population that I'm treating, they're definitely in a shoe by like week 8 to week 10. And then we start really advancing activities like normal life week 12 onward. And so most patients are back to normal life kind of week 12 to week 16. And then we're just building strength and endurance, getting them back to the exercise regimen that they like.
Okay. Now, to ease from the transition from wearing a boot to a shoe, are there certain shoes that you'd recommend?
Yeah, so I recommend to all my foot and ankle surgery patients, when you go from a walking boot into a shoe, that's a big jump. That's like me playing on a 6-foot basketball hoop and then going to a 10-foot basketball hoop. I can dunk on one, I can't dunk on the other. And so when you're making that big jump, you want to make sure that you're investing in a good quality shoe that's going to support your foot, at least for the next year, as we complete our rehabilitation, build our strength, and we're teaching how to walk differently again. My go-to brand is Brooks. I wear Brooks. My family wears Brooks. My wife wears Brooks. I drink the Kool-Aid. I've always had good results with that shoe. I traditionally tell them you need to stick to a shoe that is based for endurance or kind of like marathon running, which, that's what Brooks was based on. The big fashionable thing is to go to Nike or Adidas or something like that. Those shoes are built for more sprinting or fashion. And so they're not offering your foot much support. They typically run narrow, and we just did surgery on a foot that's swollen. And so we want something that's a little bit more accommodating. The other thing that works well is a good like trail shoe or a good like low hiking shoe. It's got a nice stiff sole. It's really supportive. It absorbs some shock from the foot as we're getting further along in our recovery. And so I try to guide patients to that depending on their activity, their body size, body type, and what we're looking at, how's the foot behaving. But traditionally, I tell them to try to stick to that, at least for the first 3 to 6 months after the surgery, just to yield a better result as we complete our recovery.
Okay. Now, there are some ladies that love their heels, which may have resulted in the bunion. When would they be able to get back to wearing, even if it's shorter height heels?
So I tell my female population that, insist on wearing heels or a little bit of a wedge. It's a risk. It's good for business. It's bad for your feet. You know that. You just had a bunion procedure, which, like, you nailed it. The high heel probably contributed to it, developing it, or at least getting worse. I tell all my female patients, you're not going to taste a high heel till about 3 months after the surgery. My preference is from month 3 to 6. It's an inch or less. My preference after 6 months is to never go above an inch. But if you do, build in gradual intervals. You should not go above 3 inches until a year out after from the surgery. If you're building your retirement account, you want a safe short-term investment that's going to yield you long-term results. And that's really what surgery is. And so we just need to kind of alter our approach, invest those 10 days, get you into shoes at 8 weeks, as opposed to abusing it early and not seeing shoes for 12 or 16 weeks.